According to interviews done, Magaji's suggestion has been met with criticism from unions such as the Nigerian Medical Association and the Nigerian Labour Congress. While Magaji believes privatization could improve efficiency, he also acknowledges the potential hardship it may cause and emphasizes the need to review the health insurance system to reduce out-of-pocket expenses. This morning, we're joined by the president of the Nigerian Medical Association, Bala Audu. Good morning. Thank you very much for joining us.
Thank you for having me.
All right. So I think my first question to you would be looking at this. Conversations about privatizing public institutions have been conversations that have been going on for the longest time. Even I remember we did have it, sometime in 2014, but was also kicked against. So what side of the divide are you on? Would you say are you for or against privatization of public health institutions?
Well, I'll go straight to the point. We're definitely against privatization of public health institutions, particularly our teaching hospitals. And I'll give you fundamental reasons why. First and foremost, let's look at what do these teaching hospitals represent. Teaching hospitals are there because they serve medical schools in universities. These colleges of medical sciences train the medical health power needs of this country and beyond, both at undergraduate and postgraduate level, from medicine, dentistry, nursing, radiography, physiotherapy, you name it. All healthcare personnel in this country are trained through our colleges of medicine, through the teaching hospitals, which form the greater part of their training period. Now, to try to even think about privatizing these institutions will be the greatest disservice anybody could do to this country, particularly to the health sector.
All right.
Now, these teaching hospitals, if you see their products, that is why you can have the ongoing immigration of doctors out of this country. Because the quality of what they train at undergraduate and postgraduate level meets international best standards. And that is why there is a major struggle by other countries, including developing countries of the United States, United Kingdom, to actually come and employ the doctors, dentists, and other healthcare providers that are trained in these institutions. So where are we talking about the inefficiency? Is it which component of the triple mandate is there inefficiency? Is it in the training component, in the research component, or is it in the service delivery component? Now, looking at the next step also, who wants to buy these teaching hospitals anyway? What is the quantum of taxpayers' funds as well as national funds that have been pumped into these hospitals? I would think that anybody who would want to buy these hospitals must be a trillionaire, because at their current value, I'm sure each of them will be worth over $1 trillion. If you look just at the prime land where they are located, not to even talk of the kind of infrastructure and equipment that is in these facilities.
All right.
So anybody...
There are many areas that you've highlighted, really.
Anybody who has the interest of introducing efficiency into healthcare delivery in this country, particularly in the triple mandate of training, research, and service delivery, and has this kind of funds to actually buy any of these hospitals, I think if that individual is serious, the individual should go and start from the scratch his own modern teaching hospital to compete with these teaching hospitals.
All right.
And then if he competes and he shows that he is better than the existing ones, then he can vie for them. But to come out of the blue without having anything to buy any of these facilities, I think it would be the greatest disservice to this country.
All right, let's talk about, I mean, you've highlighted many things. You've talked about how you're strongly against privatization. And quite frankly, you're not the only one. There are many people who would agree with you as to the fact that whilst it may look like a good idea on the surface, really, it's not maybe the best option to take, and not even now, especially where we're talking about a country that is battling with multidimensional poverty, and the number of people who would even get access to this healthcare that will then be cut off. I want us to talk about brain drain. In 2023 alone, there were about over 900 resident doctors that left Nigeria and over 1,400 who indicated their interest. What is the current reality of what we have regarding brain drain? And what would you say are your projections for where we are headed in terms of how we are seeing a mass exodus of our medical personnel out of the country?
We expect a continuation of this mass exodus in the current circumstance. We expect increasing challenges of retaining our well-trained health professionals in this country unless the government intervenes. And in this situation, I have examples to give. The same committee chair on tertiary health institution, Honorable Amos, declared a state of emergency in health, and we were all there and we made contributions. If the National Assembly contributions that were made at that declaration, then we stand a great chance, not just of stopping the brain drain, but we can reverse it. But more than just reversing the brain drain, we know that the coordinating minister of Health and Social Welfare of this party has declared that medical schools should increase their carrying capacity to double what we are currently admitting. And facilities are being provided to ensure that happens. To ensure that the training goes on as effectively as it is going currently, so effective that countries from all over the world are yet to have products, graduates from this country, then it also means we need to double the training capacity of these institutions in terms of the manpower for the training, the infrastructure for the training, and the equipment for the training. And the only way we can achieve that is if we reverse this emigration of health professionals out of this country. Okay. Amongst the push factors that sends them out of this country, of course, is the remuneration and the workplace environment. If we correct the challenges we have with the workplace environment and we improve the welfare and take-home pay of healthcare providers, I can assure you in no time, not only will we halt the brain drain, but we are also going to reverse it. We are not just only going to reverse the brain drain, but we are even also going to reverse the flight of capital out of this country in the form of medical tourism. We have the solutions to these challenges, and we're just waiting for government to adopt these solutions that we are providing.
All right, Ms. Audu, let's also look at the fact that currently the medical system, if I dare say, is heading to a state of comatose because you do not have the required personnel, doctors and so on, just as you've mentioned. A lot of them are indeed migrating, leaving the country. And let's also talk about the apparatus. Let's talk about the instruments, equipment, everything needed to actually carry out a successful medical, practice. But don't you think if it's privatized, it would now enhance efficiency, also allow other medical practitioners to indeed return back to Nigeria and be able to set up their own medical facilities, because this time the government would not have a hold on each of these medical decisions that would be made. Of course, we know there will be, governing whatever processes are being done, but don't you think privatization is the key to be able to help Nigerians and also bring back those who have initially left the country?
Now, let's look at what happens all over the world. There is nowhere in the world where the health sector is left in private hands. Healthcare delivery to the citizens of every nation is a human right of all citizens of that nation, including this country. And therefore, to say we're going to privatize what has been put together for the benefit and collective interests of the Nigerian people and put it in the hands of private individuals who have not even demonstrated capacity of handling such fundamental responsibilities and the magnitude of issues that the teaching hospitals address, I think will not just produce inefficiency. It will move from being comatose, if indeed our health sector is comatose, which I challenge anybody to discuss that issue. I do not believe it is comatose. But let's assume from assumption that it's comatose. I think we will just be digging its grave. Now, what is the efficiency we are talking about? I've explained clearly that teaching hospitals have a triple mandate. So when you privatize them, what efficiency do you want to introduce? Is it in the training of the healthcare providers at undergraduate and postgraduate level that you think you can do better than what is ongoing? And what is the evidence base that there is capacity to do that? And who has demonstrated that in this country? Or is it the research component? What is the research output of these private individuals? Or is it the service delivery? Now, let's look at the service delivery, which is often the issue everybody is talking about. By their very nature of establishment, teaching hospitals are tertiary health institutions, which means they receive difficult and challenging cases from secondary health institutions, who also receive their cases on referral from primary health institutions. And we all know that generally, primary health institutions are under the purview of local governments, secondary under the purview of state governments, and tertiary under the purview of the federal government. Which means, to be effective and efficient, teaching hospitals must concentrate on delivering tertiary health care.
Okay.
However, we know in reality, tertiary hospitals are delivering primary care, they are delivering secondary care, they are delivering tertiary care, in spite of the dwindling health manpower for them to do this. Which means their personnel, the healthcare personnel, are overstretched. The facilities are overstressed.
Well said. We've gotten your points, and I mean, I think it's worthy of looking.
In private sector, are you saying that they will now stop all these services that our teaching hospitals have taken upon themselves to deliver because there is a breakdown down the line? Then who will now do these responsibilities? I think, if anything, our teaching hospitals need to be appreciated for taking the bull by the horn. We remain the most effective and efficient public sector.
Mr. Audu, I get your point, and we can say rightly that, I mean, you've made some salient points here, and I think we need to actually juxtapose and, of course, put in a balance what privatization would be and what it would bring, and most importantly, with the points that you've laid down, which is worthy of reviewing again. Unfortunately, we'd like to have you join us again next time so we can have an extensive conversation on this. But we need to move on to our next story. Thank you so much for taking time out to join us. And by the way,
thank you for your time.
I was looking at your bow tie.
Thank you.
I wish I could have the bow tie. Maybe next time.
Thank you very much for your time with us.
Thank you.